we have Dr. Saggu who probably agrees. Stay home and use
Good
your
evening, sir.
phone.
Welcome
That's
to the
what
show.
he's saying. Stay home and use your phone.
Yeah, stay home and use the phone.
That's it. Oh,
So,
good.
I would, Kim, so I think today we should talk about bariatric surgery with Dr. Saggu because all our viewers would like to see how soon we can do the show with Dr. Saggu at a consistent time,
Yeah,
which is
people
not.
are excited. Exactly. So let's talk a
So we
little
are
bit
not able to
about
do it. So I'll just put up a poster about the show. So that is what the show we are trying to do with
every
Dr. Saggu.
Friday,
Yeah.
11
But
a.m.
we are not able to fix up the schedule because of what's going on. So we'll try to fix up a schedule and then we'll do it on the schedule as well.
Exactly.
So I would like to take initiation to ask Dr. Saggu that what is bariatric surgery and what kind of help or process it is for people who are obese. Can you please elaborate, sir?
Yeah. Thank you, Kim and Ankit, for giving me opportunity to speak on this so vast topic. So let's start with the current scenario. We are fighting against the COVID-19 infection, and this has been a biggest crisis for us, which is taking our all the resources and even overwhelming the healthcare system. So the CDC has reviewed a study, and what they studied the risk factor by which the COVID-19 patients were admitted in the hospital. So they included so many countries, they included so many states in the study, and then the inference was when they studied the patients in the age group of 18 to 49 years, and they saw the major risk factor. Around 60% of these patients admitted in the hospital with COVID-19, they were obese. From 50 to 64 years of the age group, they were admitted in the hospital. Around 49 to 50% they were obese. And when they studied more than 65 years of the patients admitted in the hospital, around 70% of them they were having hypertension, but 41% they were having obesity. So what we see that obesity is becoming a biggest risk factor for the death from the COVID-19 infection. So there is a definitely link between the obesity and the poor diet. So now we can say the obesity and the poor diet is emerging as one of the biggest risk factor for the severe response to COVID-19. Because when the patient of the COVID-19 is admitted in the hospital, so he or she must be having a severe complications. And all those complications, the root cause is becoming as an obesity. So obesity is becoming a biggest factor, risk factor for these COVID-19 patients to having severe response with a severe disease, severe illness, complication, which is leading into the death. So again, when we talk about obesity, when we talk about the poor diet, then definitely one word is coming into mind, that is the junk food. So why this junk food is being served over and over in the whole of the globe. So obesity, type 2 diabetes, or the high blood pressure, they are interlinked. Because of the obesity, you can have a diabetes, you can have a high blood pressure, and all these conditions, they can be because of your junk food. So now the mortality is increasing in obese people, and you can say the more than 50% of calories which we are consuming, they are because of ultra processed diet. And what is ultra processed diet? So ultra processed food is a mass packaged food which is full of additives and preservatives and having high concentration of the fat, high concentration of the seed oils, high concentration of the sugar, that is concentrated sugars we can say, and the starch. So who is doing all these things? So yes, we are behind all these things. Even the food industries, they are behind this, because the food industries, they have managed to make available this type of the ultra processed diet to anybody, anywhere, anytime. So easily, you can say easily approached diet is the ultra processed diet. Now we can say, because we don't have a much time to prepare the food, to cook a healthy food. So this type of the diet is easily available everywhere. So this type of the diet, poor diet, junk food, and all these, they are leading to obesity. What is obesity? Obesity, you can say it is excessive accumulation of the fat, which can lead to your ill health, which can lead to your comorbid condition, which can lead to cardiovascular complications, which can lead to your pulmonary, your lung related complication, which can lead to your kidney damage, which can lead to infertility in young females, which can lead to some sort of cancers, which can lead to your back problem, your musculoskeletal problem. So we can say the obesity is the only one word which can cause lots and lots of problems. So when we are going to define the obesity is a chronic, is a relapsing condition, is a multifactorial originated problem. It's a neurobehavioral disease. So, wherein the increase in the body fat promotes adipose tissue dysfunction. So, our adipose tissue is going to have a lot of dysfunction, and because of this, it can result into adverse metabolic, biomechanical, psychosocial health consequences. So, whatsoever the problems we are facing now, this may be directly or indirectly related to obesity, right? So obesity can be, we can say, the cause of obesity. It may be genetic, it may be non-genetic. In the genetic, we can see that some genetic structure is there which can cause the obesity. Some sort of syndromes are there which can lead to childhood obesity, like Prader-Willi syndrome or other type of the syndromes. So they can be the cause of uh, maybe some leptin deficiency is also there. Fragile X syndrome is also there. Some craniopharyngioma is also there. So these all conditions, so genetically they are related to obesity. But yes, the non-genetic factors are more important than the genetic factors. You can see what we see, the environment plays a major role in the origin of the obesity. So environment can be your family environment, how your family is behaving to your meals, to the food, your home, how your home is indulging you in the physical activities, how is your geographic area, like maybe the obesity prevalence is different in India, it may be different from US, it may be different from Australia, it may be different from other Asian countries. Then the culture of your family is very important. Because of the culture, you have fixed constituents of your diet. You are not you don't want to go out of the constituents of your diet which you take culturally. So the culture also plays a major role in the origin of obesity. The lack of optimal nutrition and the physical activities. So so there is changes in the mode of transport. There is a changes in the profession also, in the type of profession also. So now we are dealing with the more sedentary lifestyle, more sedentary professional behavior. Even if I'm working in the office, so our physical activity is not much. So physically we are not active. So this physical inactivity, because of your sedentary lifestyle, it adds on to become yourself as an obese people. So then maybe a disrupted sleep. If you're not taking good sleep, your sleep is not good, it's poor quality sleep, you have too little sleep or you have too much sleep. Even the too little and the too much, both the categories, they are very, very dangerous regarding the obesity development. While sleeping, we have other type of hormone, and while waking late nights, we have different type of the hormones which is being secreted. So when we are not sleeping well, when we are awakening in the nights, then there is a ghrelin type of hormone. So there is increased concentration of the ghrelin. The people who are late sleepers, the people who don't sleep in time. So because of the high concentration of the ghrelin, the chances of high appetite is there. Then the patient consumes more food and become more obese. Then a lot of stress is also there. Because of the disrupted sleep, you have a mental stress. So the mental stress also, it increases the chances of obesity by secreting the stress-inducing hormones. And because if you are under stress, if you are under depression, you take some sort of medications also, and those medications, they have a lot of side effects, and one of them is the obesity. They causes the deposition of the adipose tissue. Some neurological dysfunctions like your brain dysfunction, your hypothalamic dysfunction, your leptin resistance, they can also cause the obesity. Some sort of infection also cause the obesity, and very important that your gut microbiota plays a good role reducing your obesity, because we have millions of bacteria inside our food pipe, and those are the good bacteria. They provide you immunity as well. They provide you a lot of things. They provide you the strength. So if we don't have a microbiota, so how we flush out the microbiota? By taking ultra processed food, by taking the things which are not good for our body, by taking a lot of sweets. So by taking all this type of the meals, we are going to flush out our microbiota. If the microbiota is not there, we are prone to have a recurrent infection. If microbiota is not good amount present in your gut, then you are more prone to have COVID-19s. Then you are more prone to have a lot of infections. So they causes the transmission of pro-inflammatory state. So when there is an inflammation in the gut, you don't have a good microbiota, then you are more prone to have an obesity. So these are all the causes for the obesity, and one hypothesis is there, that is the thrifty gene hypothesis. So basically that is for the Asian population, what the God has done during the development, they gave a thrifty genes mainly to the Asian people, because we Asian people, we were more prone to exposed to have a starvation, more of climatic disasters, or when there is a food starvation. So then these thrifty genes, they play a major role by conserving the energy, so that we can use when there is a time of starvation or the disaster. So this thrifty gene hypothesis, but now what in the modern society? So now we have increased our intake of the calorie in excess of the metabolic needs. So same thing happened. So earlier we used to earn just for our livelihood, so that we can use our money for the daily routines. But after that, we started conserving all the finances that is in excess of our use. So the same thing happened with the thrifty hypothesis, because thrifty was given to us just to have a food, so that we can use that food in our starvation period. But now we started accumulating that extra calories in the form of obesity, that is in excess of our metabolic needs. So that is a major reason for the obesity in the Asian population, and that is different from the Western population. If we see the obesity in Indian population and the US people, so we have moreover central obesity, and the US Western countries, there is a peripheral obesity. So this central obesity is more dangerous as compared to the Western obesity, because we are more prone to have a comorbid condition like diabetes, like blood pressure, and other conditions at the lower BMI as compared to the Western populations. So then Ankit, we can talk about the management of obesity, and what are all type of the hormones which are present that leads to obesity, because this is basically a neurohormonal factors which plays in the the origination of the obesity. A lot of this is not because of that we have taken extra food, or we have not consumed that calories. The lot of hormones, they are also playing role in the development of obesity. And if we talk about the bariatric surgery works on the basis of those hormones. So if you talk about the neurohormone factors in the obesity, there are a lot of hormones, like insulin is a major hormone which plays a good role, and it basically it decreases the appetite. Insulin decreases the appetite. It is a anorexogenic hormone which decreases your appetite, and it is secreted by your pancreas at the beta cells. And another is the ghrelin. Ghrelin is secreted by the stomach, but it is a potent orexogenic hormone. It causes increase in your hunger, decrease in your appetite. So basically, ghrelin is responsible for the obesity. Other hormone PYY is from the gut. That is also like insulin-like hormone. It decreases your appetite and it decreases your obesity. Other the GLP hormone, GLP-1 is there, and some other type of cholecystokine. They are all hormones. So basically, obesity is controlled by a brain and gut axis, in the food pipe and the brain axis. So when the food is going into your food pipe, your digestive system, and from there, a lot of hormones they are being secreted, and they are sending the signal to the brain, telling the brain that now you have to stop drinking or eating because now your appetite is good. So these type of the hormones, they causes basically suppressing your appetite and increasing your satiety. So all these hormones, they are responsible for this. Now, if you talk about the how obesity ruin your life, it can have an impact on a lot of things like your cardiovascular system. So on your cardiovascular system, it can cause increase in the blood pressure, like a hypertension. I think we can make it more entertaining if you ask questions, because if I keep on speaking and you may be bored,
I'm not
we can have.
bored. So here's the thing. I'm typing notes and listening, and I'm like, why haven't we
Yeah,
had this conversation years ago? You're saying
yeah,
everything I think people need to hear. That
yeah, yes,
and so no, I'm not going to. I just stopped you. But no, you're saying things we really need to hear. These are from your heart too, and I'm going to tell you something. You do the surgery to help these people. So you're not making money telling us how to get healthier, but you
yeah,
care about us. And I think this is
yeah,
beautiful. Nick would be go, is he crazy? He can tell everybody eat bad, keep doing your bad habits, and I'm just going to keep making money on you. But
yeah,
you care about people, and
yeah,
I mean, there are healthier ways to live our lives, and we're killing ourselves, and we're allowing ourselves to not have the immunity we need to fight the viruses. And um, after I listen to you, I'm putting aside my junk food. I'm putting I drink tea.
yeah, yeah.
So.
According to the data of 2016, 13% of the population, adult population of the whole world, were obese. Not the overweight, obese. And for
13%.
around more than 40, yeah, more than 45%, they were having overweight. So this, because earlier the obesity was there only in the countries they are, I mean, they are high economic countries, but now the obesity has started in the low economic countries as well. So earlier starvation was there in Asian countries, and the people they used to keep, I mean, having mortality because of starvation. And now in the low economic countries also, this obesity has taken over, and the obesity has become the major cause of the mortality or the morbidity in the Asian countries. So now the obesity is being spreading everywhere, and it is not, I mean, choosing the countries where high economic or the low economic. So it's being everywhere now, and the things which we can control, we should control. At least we should control the food industry. This is because of the heavy advertisement of the food industries, and because of the ultra processed diet, because of the food industries. Why don't they make a good healthy choices food also? Why
Well,
can't they make aware?
why are we allowing our children to become obese? Come on, people. There should be something wrong with you. In fact, I'm sorry. I hate to say this. I'm going to get fired over this one. But I think that if you're allowing your child to become obese, they should take your child away from you, period. But I've seen so many obese children. I know sometimes maybe their bodies can't help it, but you can get help for your child. You don't have to give them everything they want to eat, you know? Um, and I agree with you. We need to regulate our food. My goodness. Okay, so this is the last day. Um, it's almost like they intentionally let us get the bad foods. They know we're going to get to them. And I don't know if any of you have ever done this, but I mean, I know if I start drinking a Coca-Cola, which usually calms my stomach down if I'm sick, but if I drink a soda, I start craving it. It's like there's something in it.
Yeah.
And so the next day, I got to have it. The next day. And, I'm a very strong person. I know that the doctors could give me any painkiller I want, and I choose not to, even though it's easier to take the painkillers and stuff. But there's something in some of those things, I think, that make people addicted. And some people are just weaker than others, but people don't exercise properly. They eat poorly. We eat poorly because we're not given any other choices usually. It's cheaper to buy a bag of potato chips than it is a bag of oranges. It shouldn't be that way, right? I should be able to feed my kids a bag of oranges cheaper than I do a bag of potato chips. But you're right, Dr. Saggu. What are some other things we do to help prevent the obesity in children? I think it begins in children.
Yeah.
He can't hear me.
So, Dr. Saggu, do you think fast food is the major problem for children to get obese?
Yeah, so the fast food is a easily available food. It's a prepaid food, easily pickable food, and some sort of fast food is in the reach of the children when they are awakening late night. So I mean that time also it's easily available. So why don't we change the environment of our family? So at least we should tell them the healthy questions of the diet, healthy patterns of the eating, and why should we take away the screens, all the screens we have? Our children have a mobile, they have a television, and by looking at the television they are eating their foods. So this may not be a mindful eating.
Exactly.
At least we should have a mindful eating. We should be concentrating our food while eating.
No, I did this theory one time. We would have board meetings. You remember this, Aunt Kit? We would have board meetings, and I would play a Coca-Cola being poured, right? And I would just play it over in one square, Coca. And before the meeting was over, everybody goes, "I got to go get something to drink." So we program people to think this. The other thing we do wrong is Happy Meals. Do you know what they are in your country? Happy Meals. The kids.
Yeah, Happy Meals. Yeah, it's there in India.
Right. So my son we would go to McDonald's when we traveled a lot, right? But he didn't want the junk. He thought French fries and hamburgers were bad. He wanted the salad. So I would ask them, would you give him the Happy Meal if I buy a salad, the toy? Would you give him the toy if I buy the salad? Oh, no, you have to buy the hamburger and but my kid doesn't want the hamburger and the French fries. He wants the salad because he's afraid of a heart attack. And, at a young age, he was afraid of a heart attack. And so they would go, no. So I would have to buy the Happy Meal. So he would get the toy. And then I would buy a salad for him. And I would.
But that Happy Meal is, that Happy Meal that is the most unhappy meal you can see.
Thank you. Why did they put a salad in there for kids? Why did they put a salad in there or apple?
Sorry.
So I agree. It's unhappy.
That's marketing gimmick. I mean, they purposely don't want salad in Happy Meals, and they want people or kids to buy Happy Meal, and they should buy again and again, and then they get obese. And after obese, I think they get a lot of chronic disease. So I would like to welcome Dr. Kuller as well, and on a discussion about obesity. Welcome, Dr. Kuller. Good evening and namaste. So we have Dr. Saggu with us. Dr. Saggu is a bariatric surgeon at Apollo Hospital, Delhi, and we were discussing about obesity, especially in child obesity, because obesity turns out to be a lot of chronic disease. I mean, you are a better judge than us, so you can elaborate how obesity creates a lot of new disease in the lifeline.
Well, you see, as a nephrologist, I would like to limit myself predominantly to what obesity can do to the kidneys. Well, there is a direct correlation of obesity with many kind of glomerular diseases like focal and segmental glomerulosclerosis, and it's actually been seen that obesity could be an independent risk factor for the causation of chronic kidney disease. So obviously, we tend to many a times take the help of Dr. Saggu to help us take care of the obesity of our patients, because uh, one, it is the one of the reasons which can cause chronic kidney disease, and equally important is that we find it difficult to manage these patients once they have advanced chronic kidney disease. I'm saying, if we were to transplant these patients, God forbid, if they have end-stage kidney disease, and we were to plan their renal replacement therapy, which is in two forms, either dialysis, lifelong dialysis, or transplantation. Now, we always believe that kidney transplantation is the preferred modality of treatment of such patients, and we would always want to offer. So one big impediment is when we find our patients grossly obese, and when we, from both the recipient point of view, one who is going to accept the new kidney, as well as from the point of view of a donor. So many times we reject a family member who would be willing to be a donor. We would be rejecting them just because they're obese. So obesity is something which scares us as well as nephrologists.
So just to decrease the weight, maybe by bariatric surgery or by dieting or by exercise, the idea is to just decrease the BMI. So by decreasing the BMI, Dr. Khulla will agree to me that there is a abrupt change of improvement of the renal function. There is an abrupt improvement in the filtration, and definitely the medicine doses they want to use after the surgery, that will also go down.
Quite interesting, you see, and there was a lot of interest in this field. The jury is still out. I would not be able to say that we have the final word whether we should be advocating bariatric surgery to all those patients who could not manage their obesity through diet or exercise alone, because there are two aspects to it. One is slowing down the rate of progression of chronic kidney disease. If we subject a patient who already has had a chronic kidney disease, by subjecting them to weight loss surgery, at least theoretically, we can probably slow down the rate of progression of this disease. As I said, we don't have the final answer to that, and we must always keep that in mind, that there are some adverse events associated with such surgeries as well. So we have to very carefully select our patients. Now, secondly, while these patients are progressing from milder form of chronic kidney disease to more advanced, and we know that renal replacement therapy is imminent, we would, as I said, want them to be thinner as compared to grossly obese, because it'll be making our decision to advocate kidney transplantation in them much easier. So there are a whole lot of things which go on in our minds. So with that in mind, there has been a lot of recent research. We have actually tried to see whether it really is the case. When I say that by subjecting them to weight loss surgery, we can slow down the rate of progression, but we need to have a definite answer. That's one. People have seen that diabetes, which we have very often discussed is the main cause of chronic kidney disease, gets under control in a much better fashion once these patients shed weight, either through the normal maneuvers or through, in the extreme cases, weight loss surgery. So diabetes control definitely becomes better. What we really want to know is whether this translates into slowing down the rate of progression of chronic kidney disease. That's another thing which we want to know. And as I said, the caution is that there are some side effects of this surgery. We have come across cases whereby they had risk of oxalate stones. There was hyperoxaluria. So there were some issues with the weight loss surgery techniques as well. One of them causes a few kind of symptoms, a few kind of side effects, while the other one may not be causing those many. So Dr. Saggu is the master there. So, but this is what goes on typically in the mind of a nephrologist when we are going to subject our patients to weight loss surgery and when we hand them over to surgeons like Dr. Sabur.
Yeah, Dr. Kuller, I agree. I 100% agree with you. So, what is important? Important is the choice of the procedure, right? If the patient is going for the renal transplant surgery, and when we are going for the gastric bypass, I think we should be more conservative by choosing a procedure for that. If we do more restrictive or less maladaptive procedure on those patients, then the chances of hyperoxaluria would be less, and we can have a more chances of improvement of the kidney functions, as well as we can have a check on the progression of the kidney disease.
Quite true. Quite true.
Yeah.
And Dr. Kuller, our viewers would like to know that if a patient is obese and is having some chronic kidney disease, if the patient, can he sustain the two major surgeries, bariatric surgery as well as the transplant surgery within a span of a year or so?
Well, that's quite an important question, and again, we have to take that final decision on a case-to-case basis. The safety of the patient first, and I'll give you some very interesting observation again at the same time. While on one hand, I'm strongly saying that transplantation is the definitive answer for end-stage kidney disease. We would want to offer that as the definitive treatment for our patients. At the same time, you would agree that majority of these patients have to, unfortunately, since they have no other option, to stay back on dialysis. Now, the interesting observation, what I was referring to was, it has been seen that people who are obese tend to do better. They fare better while on dialysis. So their obesity here is actually protecting them. So when you compare the obese patients with the thinner ones, the lean ones, it was observed that people who were on the obese side had better long-term outcomes. So it's a bit confusing, but then what we have to understand is, given a choice, one would want to subject him to kidney transplantation, and if they have to stay on hemodialysis or any form of dialysis, we would prefer them to be staying in the average range, a little on the obese side rather than on this side of the curve.
That is such an effective statement. I would like to know, for all of the surgeries that you do for people with obesity, how many of them really stay healthy after? Are they mindful, and what is the ratio of people who just go back to the way they were?